So what comes to mind when thinking of the word marijuana? Does it make you think of hippies, so-called munchies, peace and love, or does it have a negative connotation of a legal drug and jail time? Cannabis has in fact been around and used for thousands of years in many different religious practices and medical usage worldwide. In our nation's past, marijuana was freely grown, sold in pharmacies, and smoked wherever you wanted. This came to a halt with the Marijuana Tax Act of 1937, which made possession of cannabis illegal. This was also around the time of alcohol prohibition. But according to Webster Dictionary, cannabis is a naturally occurring plant on this earth. If it has been used for thousands of years, was once legal, and can promote well-being of people, why can't it be again? In this presentation, I will be explaining why the legalization of marijuana can be a good thing for our country, and how it can improve the health of individuals. So people view marijuana as a drug. According to the dictionary, a drug is a chemical substance used in treatment of medical conditions to enhance well-being. I'm sure we have all heard of medical marijuana uses, but what does it really do? According to the FDA, there are two types of cannabis that are used to treat condition. One type is CBD and the other is THC. Both are used to decrease pain and inflammation. CBD can be used for epileptic seizures, while THC is used to increase the appetite and decrease nausea and vomiting. So someone maybe along the lines of a cancer patient. So in a CNN interview, they noted that there are 8 medical conditions for which patients can use cannabis. Those 8 are HIV and AIDS, cancer, glaucoma, seizures, severe pain, muscle spasms, severe nausea, dramatic weight loss, and muscle atrophy. So now that we have established the definition of a drug and the types of cannabis used that is FDA approved, let me move into what is legal to prescribe for every condition of pain and how it has a negative impact on our society and patient population. So we prescribe things such as painkillers instead, which can be perfectly adequate. But what do we really know about painkillers though? According to the CDC, we have about 44 deaths a day on painkillers every day. So that's around 45,000 people alone on prescription drugs that pass away every year. That's not including the amount of people that are getting addicted every day. And this doesn't even include alcohol or illegal drugs at all. I actually have a list of drugs from my drug book. So this is my pharmacology book. It literally has a list, 200 pages that describe the painkillers that we prescribe to patients. 200 different types. There's no documented case of a cannabis drug overdose that has ever occurred. So let me ask you, why is it not legal in all states if these statistics occur? Why are we prescribing things to patients that 44 people a day overdose and die on? So now that you can see the correlation with the statistics of prescription overdose and the non-existent overdose rate with cannabis and how it can help people and what it is used for, then let's look at some personal cases and some more numbers. So how common are the disorders that qualify for the treatment of marijuana? So we have 1 in 26 Americans that are diagnosed with a seizure disorder. That's around 3 million Americans. And that is a large population of Americans. So how effective is that treatment? Well, let's look at a nationally recognized case. Before I do, I'm going to show you a video of a girl who is actually having a seizure so you can see what the damage can do. So let me play this for you. This is a young girl having an epileptic seizure episode. that is terrifying. So, if 1 in 26 Americans have a seizure disorder, that is a large population. So, let's look at a young girl who is infamous. Her name is Charlie. She lives in Colorado. I watched a documentary on PBS. She's been on the news for CBN. She had her first seizure at 3 months old and would continuously have them. So have you ever seen a person have a seizure? Like that video, keep that video in mind. She was having about 300 seizures a week. Can you imagine seeing that with your child 300 times a week? It'd be terrible. The parents had said their goodbyes when they had decided to try and get her on for a medical marijuana license when she was just 5 years old. Her seizures are now down to 2 to 3 a month. She is now talking, walking, and laughing. This is a remarkable story. These parents were saying their goodbye to their child and found a way for her to improve and actually have a life with controlled symptoms. So now that you can see that legalization concern really should not be a concern due to the amounts of Americans and patients that it can help. Let me ask you, what can come with the legalization of marijuana? Would it help others in pain who do not have the 8 listed conditions above? It could decrease the amount of addictions and deaths related to prescribed painkillers. This is hydrocodone that I got from my dentist. Even dentists prescribe painkillers. We can make a profit and fund our healthcare system and put money into research or education. So is it truly a negative thing for our society? We are failing our patients and a great opportunity for our country to make an advancement and improve healthcare. I see a lot of death. I see a lot of people in pain. So let's change that. Let's vote yes toward paving a new pathway that can improve our nation and decrease addiction and death and pain of the suffering. And please check out my PowerPoint because I have some really interesting information that I didn't have time to include in the speech. It shows different deaths related to alcohol and tobacco compared to the non-existent overdose of cannabis. So thank you guys.